everyone, Dr. Stacy here. But today I'm talking to you on behalf of my friend Connor. We're tackling a topic that's close to the hearts of many: pregnancy. Specifically, we're diving deep into the world of pregnancy myths. If you're expecting or planning to be, you know there's no shortage of advice coming from every direction. But how much of it is actually true? That's what we're here to uncover. We're going to separate fact from fiction and give you the evidence-based information you need to make the best choices for you and your little one. Pregnancy is an incredible journey, but it can also be overwhelming. Let's clear up the confusion, debunk those persistent myths, and empower you with the knowledge to have a healthy and informed pregnancy. Let's get started. Let's talk cravings. Pickles and ice cream, anyone? We've all heard those tales of women craving certain foods and attributing it to the gender of their baby. But here's the truth. Those cravings? They're not a magic gender predictor. They're actually your body's way of telling you something else. During pregnancy, your hormones are doing a whirlwind dance, and your nutritional needs change dramatically to support that growing baby. These hormonal shifts and increased nutritional demands can lead to some pretty interesting cravings. So, that sudden urge for salty fries, it might just mean you need more sodium. Don't worry, your baby will forgive you for not being able to predict their gender based on your love for chocolate. Time to tackle a myth that just won't quit: the idea that exercise is off limits during pregnancy. Now, of course, every pregnancy is unique, and it's crucial to consult with your doctor before starting any new workout routine. But for most women, staying active during pregnancy is not only safe, it's incredibly beneficial. Think of it this way: your body is already working overtime growing a human. Regular, moderate exercise can help you manage some common pregnancy discomforts like back pain and fatigue. It also helps prepare your body for labor and delivery. So lace up those sneakers, with your doctor's okay of course, and get moving. This myth is a classic. Have you heard that if you experience heartburn during pregnancy, your baby will be born with a full head of hair? As fun as it is to imagine, this myth just doesn't hold water. Let's break it down. Heartburn, that burning sensation in your chest, is super common during pregnancy. Why? You guessed it. Hormones. Those fluctuating hormone levels can relax the valve between your stomach and esophagus, allowing stomach acid to creep up, causing that uncomfortable burning feeling. It has absolutely nothing to do with the amount of hair on your little one's head. "You're eating for two now." It's a phrase we hear all the time, but it's often misinterpreted. Yes, your nutritional needs increase during pregnancy to support your baby's growth. However, that doesn't mean you need to double your calorie intake. In fact, most women only need about 300 extra calories per day, especially in the second and third trimesters. The key here is quality, not quantity. Focus on nutrient-rich foods like fruits, vegetables, lean proteins, and whole grains. These provide the essential vitamins and minerals both you and your baby need to thrive. Remember, overeating can lead to unnecessary weight gain and other complications. The big question: are all medications off limits during pregnancy? This is where things can get a little tricky, and honestly, it's crucial to consult with your healthcare provider. It's not always a simple yes or no answer. Some medications are perfectly safe to take during pregnancy, while others can pose risks. Your doctor can assess your individual situation, consider the benefits and risks of any medication, and guide you toward the safest options. Never hesitate to talk to your doctor before starting or stopping any medications, even over-the-counter ones. Time to debunk another popular myth: predicting your baby's gender based on the shape of your belly. Carrying high? It's a girl. Low and round? Definitely a boy. Sounds familiar, right? But the truth is, belly shape has more to do with your body type, muscle tone, and the baby's position in the womb, not their gender. Every pregnancy is unique, and how you carry can vary from one pregnancy to the next, even with the same gender. So, while it's fun to speculate, don't rely on belly shape as a reliable gender predictor. The final myth we're tackling today is about seafood. Now, it's true that some types of seafood are high in mercury, which can be harmful during pregnancy. But that doesn't mean you have to avoid all seafood altogether. In fact, certain types of fish, like salmon, sardines, and trout, are excellent sources of omega-3 fatty acids, which are essential for your baby's brain and eye development. The key is to choose low-mercury options and enjoy them in moderation. Your doctor can provide you with a list of safe and unsafe seafood choices. So, there you have it. 7 common pregnancy myths officially busted. Pregnancy is an incredible journey, but it can also be filled with uncertainty and a lot of unsolicited advice. By arming yourself with evidence-based information, you can navigate this special time with confidence and peace of mind. Remember, every pregnancy is unique, so what works for one person might not work for another. Always trust your instincts, ask your doctor questions, and don't be afraid to challenge those persistent myths. The more you know, the better equipped you are to make the best decisions for both you and your baby. Thank you for joining me on this myth-busting adventure. If you found this information helpful, give this video a thumbs up. Subscribe to my channel for more evidence-based health content, and don't forget to hit that notification bell so you never miss an upload. And most importantly, have a happy and healthy pregnancy.